as I mentioned in the beginning, I am a reader in the Department of Informatics and Faculty of Natural and Mathematical Sciences. I'm the leader of this project, the principal investigator. And the project itself is called Detecting and Monitoring Stroke in China using a low-cost portable microwave scanner. So already from the title, you can see some keywords here: low-cost portable, and the effort being in China. And there, we think that this focus could accelerate a bit the development of this technology, because as already mentioned by Professor Solok, if the need, it's a good application in areas where, as I'll say later, where there might be less access to current imaging technologies for stroke, like CT. But even in big cities, as we all know, getting scans is always challenging because there's big waits and everybody needs one. So, yes, there is one of this. Okay. Okay. Let's see if it works now. It doesn't. Stick this up. Try the other. Is it working? It doesn't work. Okay. Maybe I'll take the other one out. Okay. And that's it. All right. So I'm just going to introduce a bit the project. So what's the motivation? So the idea is that, and we know the first who thought about this, and I'll also cover other groups and even companies that are trying to develop this technology, is that if you have a device that is portable, that's the main key aspect of it, small enough to be, for example, inserted in an ambulance, then, and if you can tell what type of stroke you have when it first hits, and throughout the workshop, when people who are not familiar with stroke, they learn that there are two types, hemorrhagic and ischemic, and depending on the type, the one takes thrombolytic treatment, but so you have to know what type of stroke there is. You have, and therefore the challenge is that typically this is done by going to a hospital with a CT scan, and there's a critical time of a few hours, perhaps, depending on where you are, where you don't know what type of stroke the patient had, and therefore you cannot apply treatment. So if there was such a device inside an ambulance, then we could save a lot of critical time if it was accurate enough to detect between the two types. Then we could make a decision on treatment. There is also this other concept of using of monitoring as a bedside tool, which also would fit a device like this. So perhaps you'd have to be tuned to this diagnostic decision, not necessarily in this case determining between the two types of stroke, but creating images that are not as accurate perhaps as CT in terms of resolution, but can tell something about the stroke and how it involves with time, the risk of reoccurrence and all that. So that would be a second application where it's used as to monitor the evolution of stroke in therapy. So, and again, the motivation behind this specific project, which focuses, which is a GCRF project, Professor Lack mentioned something about the scheme, and I'll have a slide to explain, but is to make a difference in areas where this might be needed more. So again, this is not only, it could be only in China, it could be loads of different places in the world. Access to CT or MRI might be more challenging, and if we had a device, ideally even operation dependent, would be great to help people who suffer from disease, and also when acute stroke happens. And of course, a huge challenge in microwave imaging, as you'll also see later when I give an overview of technology, is how can we get to the clinic? This is always the key point, because we may be designing great, cool systems, but if doctors are not convinced, then they will never be adopted. And this is not trivial also because there are a lot of costs associated with trials and approvals. So in that sense, also developing something in a country like China might give a faster pathway to clinical adoption. We have a presentation which discusses about regulations in China, and we have teamed up with as you see in the workshop, with ET Medical, which is a company in China that develops devices for medical imaging, and they have showed interest in this technology. They're also developing medical scanner, breast cancer scanner with using microwaves, and they are partners in trying to take this. They have access to a lot of hospitals in China, and they are partners in trying to develop a plan for clinical exploitation of this technology. So, as I mentioned, this project, as also Professor Lack mentioned, this is under the Global Challenge Research Fund. It's a scheme which focuses on countries, developing countries or upper middle. In this case, China is an upper middle income country in this context. Although I'm a bit surprised that it is still there, but in the sense that they are quite developing, at least in terms of technology. It's certainly a good partner for us in the project, and the university partner, USTC, we have worked with Professor Yifan Chen, who couldn't be here because of visa issues. We have worked with him in the past, so we are very happy that they're part of the project. So I'm going to, so the workshop I covered this slide. Again, this is ET Medical. Mediwise is our UK partner in the project in terms of industry. I've worked with them for a long time, and they developing different devices or sort of high risk, high benefit devices, and we'll have a presentation from them later. And then, as I mentioned, USTC in China is another partner, and these are funders for the project through EPSRC. So I mentioned that too. So let me just give a brief introduction to microwave imaging for the people who are not aware of it, and how we focusing, of course, on medical applications. So what is the fundamental principle? The idea is that you exploit the contrast, the differences in the electric properties of tissues. So that means the primitive, what we call, from a physical point of view, is the complex permittivity, is the dielectric constant and the conductivity of tissue. These are the relative properties in the range of frequencies that microwaves use. Okay. So the concept is that if there is contrast, that's common with a lot of other imaging technologies like X-ray. If there is contrast between different types of tissue, then you can create an image, or maybe you can detect an anomaly, depending on the method. So why would anyone want to use a technology like this? It's safe in the sense that although microwaves, you associate microwaves, microwave ovens, and discussions about mobile phones, but this are low power devices, and of course the scanning is short time scanning, and it's not, the radiation is not ionizing as it is in X-ray, for example, or CT. I mean, the devices also lend themselves to easy examinations. There's no compression, for example, for the breast, or and they can be operation independent. And the other key, the most important of these reasons, in my view, is that there are technologies that drive other much more mature technologies that are driving down the cost and improving the hardware. So, I mean, ideally, we would like microwave imaging to be already a medical technology and have the medical sector drive this cost. But since this hasn't been done, at least there is a benefit from using hardware from telecoms, for example, about the electronics, about even the antennas, the methods, the processing methods, and this is important as a complementary technology to help this improve with time. Now, what's the main principle? So the idea is that the principle of microwave imaging is not very different from ultrasound in the sense that you have an interaction of a wave with the body of the human body region, for example, in medical imaging, and this interaction is complex. It's not just a ray that goes through and it gets attenuated, and as in X-ray, there are more complex wave phenomena, but and that makes the problem challenging. It also gives a richness to the type of information you have. But the principle is that you illuminate with ultramagnetic waves at these frequencies, and then there are signals that are scattered back, the response from the surrounding antennas. And then there is a image formation algorithm. Okay, so the signals that in the receivers, the tomographic system, it would be antennas surrounding, for example, the brain or the breast, the head of the breast, and then there is a imaging algorithm that translates that data into an image. So what are the main considerations? What does it take to work? There is the two main issues, of course, the contrast, as with any other imaging technology, and the resolution also. So, so is there contrast in human tissues that is enough to detect something? And we'll talk about that, of course. And also, microwaves are, in terms of resolution, cannot really compete with MRI or even ultrasound because the wavelength is larger. So there's a trade-off there. And if you go into higher frequencies where the wavelength becomes smaller and you can resolve objects better, the penetration depth is smaller. So there's a trade-off between those two, and we can talk about this a bit. So obviously you need to find applications where this trade-off is, you can work with this trade-off, basically. So now what's the main thing here is that what are we trying to, is there contrast? Well, the contrast typically for dielectric properties depends on the water content. Okay, so this is so high water content tissue will have very different values than low water content tissue. So for example, adipose breast fat, as you see later, and tumorous tissue will have a strong contrast, and this is why breast cancer detection has been investigated and still investigated. Dense tissue in the breast, which has higher water content, then might not have such strong contrast. So it's really this value that changes properties. And there have been studies. I mean, why did people even look into this area? There have been studies that argued, typically this is ex vivo, so tissue would be extracted from surgeries, for example, and then it was measured with microwave equipment and different techniques with the aim to look at these properties. Okay, and these are studies, for example, for breast tissue that motivated the research on breast cancer detection. At the end, there are two famous papers by Gabriel, who worked at King's, and it's sort of a great database for microwave engineers and people in the area. They did a very large-scale study of different types of tissue, and people refer to, when they do numerical studies to feasibility studies, they refer to this data a lot. So they are very well-known papers. Now, again, what is the principle again? The principle is that, for example, if you have a breast here and you have a transmitter and a bunch of receivers, and there's a tumor, then there will be a difference between the signal that you need to process, and then that you hope that this will be able to tell you where the tumor is. So again, ultrasound works like this, and any imaging technology works like this. The difference is that this interaction of the breast with the microwave can be quite complex. It's not just a straight line going through. And of course, the key here is to have a good algorithm and a good computing power to do this efficiently. And I'm just showing here two images because I want to point out there are two fundamental different techniques that have been used. One is a radar-based technique. So the idea there, as in radar or as in ultrasound, the idea is to just find as a target. Okay, create a synthetic image, not a quantitative image. So this has been used quite a lot and is being used. And we work on both techniques. And this is tomography is more of the creating an actual image of the interior. So I've put this image here because this is just to give you an idea of the type of resolution that could be achieved even in ideal situations. So this is an MRI scan that has been down sampled to a voxel of 2 millimeter size. And then this, typically a lot of groups working in the area before, for proof of principle, would take slices like this is the skin, which we have introduced. So we map MRI images to microwave data, knowing the properties, and the tomographic algorithm could work as well as this. So maybe this resolution, if it was if it could be achieved in a real system and not just in a simulation, would be a good imaging tool. But of course, it's very different to get this with an actual system than from simulations, as anyone who works in imaging will know. Okay, so it's not a new technique, and the first well-known prototype for microwave imaging that looked into medical applications was developed by Superlek, and we are lucky to have here Professor Bolomi, who was the pioneer of this technique, and you'll have a chance to talk to him, and he can tell us what went wrong, and this is not used in practice. Well, you can maybe see a little bit that the images that were back that was 30 years ago or more now, and there were, one of the problems that there wasn't enough computing power in the days to do complex algorithms, so you have to rely on simple processing of the data. But there was a really nice technology developed that basically could take images in real time, and this is the type of images you get. But then again, if a doctor saw this and compared to what they had now, and there was no clear need, then it wouldn't be necessarily something they would use. And still, this is a challenge. The resolution is a challenge. So then in the 90s, there was a great interest in the technology as a complementary approach to breast cancer detection. The argument being that, especially using radar and relying on data, early data that showed that the contrast was quite high, if you had antennas that would transmit and then process the data, you would get just information about a small tumor. So the idea is that you would detect breast cancer at early stage, which is of course important for therapy for survival rates. So there was a lot of work that was developed around that time. Now I have this slide. It's a well-known slide in the microwave imaging community that basically relied on dielectric spectroscopy studies. So again, measuring properties from surgeries, and what they wanted to see is indeed if the contrast is as strong as it was assumed. And without going into a lot of details, the main key result is that, so these are, for example, properties of dielectric constant conductivity. The two parameters that, as I mentioned, are of interest here, that we are mapping to possibly a disease or like cancer or stroke. There was a contrast with low breast fat tissue. This was tumor, the red, and this is breast fat tissue, normal breast fat tissue. This is quite strong contrast. But then there is also this normal tissue which has low it's a low percentage of adipose, so more dense tissue, and that was up here. So that contrast is not strong. Not entirely surprising, because also this issue rises in mammography. In dense tissue, it's more difficult to find tumors. But it's an important development because it shows people start thinking whether maybe the contrast is not there as much as we thought. It depends really on where the tumor sits. However, there are still a lot of groups developing prototypes for that. So this is a snapshot of recent prototypes for breast cancer. There's a well-known company in Bristol that was one of the first companies developing this, and they've done some clinical trials. They've shown some results. It's not widely used in the clinic, and we don't know if it will be, but they're still working on this and improving their system. And you can see how the examination would take place, right? The patient would sit on the back, and the imaging system would be hidden somewhere here. And there's of course electronics that process the data, and then at the end you get something in a computer. Okay, it's not operation dependent. You don't have to go and scan manually. And there are quite a few groups trying to do this. Now, what about brain tissue properties? I've discussed a bit breast tissue. There aren't that many studies that have looked at this. It's difficult, of course, to get access of brain tissue. So I mentioned this one because it's one of the few where, again, they tried to look at the contrast between ischemia and a normal, what happens with ischemia, basically. So again, in stroke, as you see, as I mentioned also in the motivation, the hope is that the device, the microwave device, will be able to detect that anomaly, right? And that anomaly might be hemorrhagic, so a lot of blood, or ischemic, which is the opposite. So to detect this, first we need to know whether the contrast is there. So again, a group that is currently has a company developing this. They published a study 2016 where they took brain tissue from animals and they performed occlusion and reperfusion with the aim to look at occlusion corresponds to ischemia. That's a very simplistic, but the idea was to perform this to see if the properties would drop, and then what happens then when there's blood. Obviously, blood does have contrast with tissue, okay? Because it's again, if it's water content based, then blood does have contrast. Blood properties were known before. What is a lot more difficult to measure is ischemia. What properties are the properties of ischemia? Based on this study and this, they've shown that there might be a 5 or 10% contrast, and this may, it may be possible to detect. So, for example, you see here, on average, of course, there's a lot of variation in the measurement. It's a very difficult measurement. It cannot be very accurate because it's an invasive technique, right? You have to go with a probe and try to measure in these areas, right? Now, I can't say more about the study. I didn't do it myself, but that's my understanding of it. The important result for us is that there seems to be some contrast also for ischemia. So now, I think I'm gonna have 5 minutes no more. So what are we trying to do with for stroke? What is the idea? I'm showing here 2 very early prototypes of a group in Sweden who have now a company on this, and their approach is they're focusing on this first concept of just being able to detect between the 2 types of stroke. And their idea is, I don't want to make an image, it might be difficult. I will train patients. I'll do something which is very popular these days, machine learning. It's nothing completely new, but that's the term. So the idea is you train, you have a data set of ischemic and hemorrhagic stroke. You use the antennas to store the signals, and you have a data set. And based on that data set, you can tell when you have a patient which of the 2 it is. So they've shown some results. These are typical detection curves, but they've shown some. They have had some success in detecting, in be able to tell between the 2 methods. And this is a company now that is developing the prototype. I have a picture of that. But the point of that is that it's one technique to do it, which doesn't require a full image. Okay, then there is another family of techniques, which is imaging, really. And again, this is another company now. And here I've included their academic work, recent academic work. And again, they have a system that is larger than you'll see a picture. Here's the interior of the electronics and all that. But they did a study where they took, with phantoms and numerical study, where they took the properties from that study, the 10%, or so basically they have a phantom here, and it has some properties of average brain tissues for epsilon and sigma, the values that we want, and then H stroke and I stroke, hemorrhagic and ischemic, their properties, and you see that the blood, if you look at this, is on 44:59. That's a good contrast, 59:40. So if these numbers are, which relied on their study, are close to reality, then this might be possible to detect with this microwave device, and they show this taking images where they actually consider the two types of stroke and the type of. This is the other thing to note is that with tomography you have quantitative image, and if the method is accurate, you can actually get the property. So that's an additional information that you will not get from MRI, for example. You actually have values associated to the tissues. So you see, for example, here this red is around 45, and this green is around 40. So one corresponds to the highest one is hemorrhagic. It can never be 100% accurate, and this is also something that the algorithms have to do this. But the concept is that they've showed a proof of concept with the simple cases. And the other thing they did is for the evolution of the stroke is they considered ischemic regions and checked how they evolve. If you change, if you have a penumbra, then ischemia, what happens with time. So then I'll be very quick for the rest. There's other systems as well, developed in other places of the world, different stages. This is basically the companies that I discussed with their methods. So Medfield is the one. This is the device that uses machine learning that just wants to differentiate between the two types of stroke. And EM Tensor is the one that has this bigger prototype that does tomography and actually tries to create images. And they both are in different stages of development. Then there is among a lot of different systems. There's one in Naples that Francesca will discuss. And then there's also the system that we are developing, and you'll hear a lot more about this later. How we are actually building it, typically going from the developing the electronics, the hardware, to testing things and then redesigning it. It's a big engineering project, and you'll hear more about that. And one question arises, why, what are we trying to do differently? So what we claim is that part of it comes from our previous work in microwave imaging, where we've shown very good resolution, like the one I showed early in breast simulations. So our approach is, if you can get this in principle, using multiple frequencies and techniques that can really improve resolution, then why not try to design a system that could get this performance? Maybe it's impossible, because in practice you'll have a lot of challenges, but at least in principle there is the capability of getting good images. And we also have these two techniques that we want to combine possibly in this project. The other thing that we are trying to do, again, I'm not saying that we are the only ones trying to do that, but it's a difference from some of the prototypes, especially in early breast cancer, is a lot of people build devices without fully characterizing them and then had problems with performance. What we're trying to do is develop it step by step and in an approach that focuses on the actual system and experiment, but also looks at it from a simulation point of view to benchmark performance, but a simulation that actually simulates the experiment very, very accurately, not just a very simple thing that would work. So, and you'll see that. So this we use, and this is another capability that wasn't there 20 or 30 years ago. There are really accurate numerical solvers of electromagnetic numerical solvers that can predict how the system would interact, the antennas, and this is important because there won't be noise. Thermal noise is not a big issue, but there are measurement errors. So you won't have the measurement errors, but you will have other realistic factors included in the modeling. So we do this to benchmark our systems as we go along, and we also want, and we also try to sort of have a bottom-up and top-down approach meeting. So developing the hardware, developing the final prototype, and meet somewhere where we have something that will work, but also will be user-focused. And this is an extra feature that will be discussed by Themos later on, metamaterial technology to improve the coupling of energy to the head. And again, another important aspect in this project is that we try to create a pathway to clinic by focusing on China and we also want to develop some partnerships. This is still the first year of the project, so we have another 2 years. Partnership and things that could help us with a clinical plan. All right, that's all. Thank you very much.